times in a year, like general surgeon, pediatrician, physician, you want to see specialists. 4 times in a year, gynecology, orthopedic, common ailments. Outpatient care for common ailments like malaria and other acute uncomplicated febrile pregnancies like diarrhea, respiratory tract infections, uncomplicated pneumonia, simple anemia that does not require blood transfusion. Simple skin disease, other uncomplicated bacteria, fungal, parasitic, and viral infection and illnesses. Then follow-up treatment on chronic illnesses like hypertension, DM, sickle cell, and asthma. Then first aid on drug bites, snake bites, scorpion sting, arthritis, and other minor musculoskeletal diseases. For childhood illnesses, feeding problems and nutritional counseling is free. Treatment of common child illnesses like malaria, diarrhea, and flu are all free. Okay, uncomplicated pneumonia and other child common diseases, they are all free. So, for eye care, treatment of minor ailments, including conjunctivitis, parasitic and allergic ailments, simple contusion, abrasion, then removal of conjunctival non-penetrating foreign body. They are all free. So for a patient that needs refraction lens and frame, patient needs 5,000 naira. Once the frame or the lens is above 5,000 naira, the patient will have to pay for the remaining fee. You understand? You have to pay for the remaining fee. For family planning services, we have counseling or family planning methods, oral contraceptive, condom, 3 units per family, 3 units per family, by policy. Provision of services, emergency contraception, injectables, implants, plates, intrauterine contraceptive device, that's property. So for child welfare services, nutritional advice, health education and other services, growth monitoring, national program of immunization, schedule for children under 5 years old. Then for hospital care and admission, for standard general ward, for a single meal where available, the patient has 15 times what? For a patient that's on the ward, the patient is entitled to 15 meals. After that 15 meals, the patient will pay for the rest. So patient will now determine if I want to eat morning, afternoon, night for 5 days. After that 15 meals, the rest patient will pay. What is it? One day. Milli. So after 15 cycles, patient will pay for the rest. So that's just on the patient, how the patient wants to take the meal. So for hospital care, provision of prescribed drugs in line with LSHS for primary care cases. For LSHS, now there's no list of drugs because we have to send to them before they have. So for now, there's no list. When we started, we had a list of medications. But now, because we send to them, they use that discretion. Yes, to approve or not to approve. And consumables, not approved. You don't want that drug. They do basically drugs, medication. Consumables, not part of it. So, for blood transfusion, you have for blood transfusion, you have to find your for blood transfusion, The patient is entitled to 2 pints, to drink 2 pints of blood per year. Free. Yes, per year. So after that, so if you use that 2 at once, the remaining ones you pay. Then for donor screening, if you want to donate, you're supposed to do for screening. For screening is free. For a LASHMA patient, it's free. So for chronic diseases, screening and diagnosis of diabetes, hypertension, asthma, treatment of diabetes, hypertension and asthma, they are all free. Periodic routine investigation for diabetes and hypertension, they are free. HIV and AIDS services, provider indicated test based on clinical guidelines, referral to HIV referral centers for treatment, client initiated testing, like once a year. Then HIV service charge. So consultation and discussion of medication, they are all free. So HIV AIDS service continues. Perinatal HIV exposure for neonates. Use of doping and nevirapine is also free for LASHMA. For TB services, Kutum test for tuberculosis is free. Referral linkages to designated treatment center for treatment for TB is free. TB service charge, don't know if they collect that, but it's also free for LASHMA patients. So for hematology, food blood count, ESR, rosacin, malaria parasite, genotype, tetanus factor, blood group, breathing time, clotting time, hemoglobin time, partial neuropathy time, cleaning of blood, they are all free under LASHMA. For the clinical chemistry, we have random and fasting blood sugar, free, electrolytes, urea and creatinine test, free, pregnancy test, normality, wider, free, oral glucose test, free, LFT, free, uric acid bilirubin, free, total protein and albumin, also free, hydropine, cholesterol, triglycerides, HDL, LDL, all free. Glycosylated hemoglobin is also free. So for microbiology, MCS is free. MCS for urine, blood, MCS, swab, urine and TSS. Also free. Analysis free. H. pylori also free. For diagnostic radiological investigation, X-ray for skull, chest, skin and vertebrae. They are all free. So ultrasound test, obstetric scan, free. Abdominopelvic USS is free for a year. ECG is free. Cervical cytology is also free. Maternal and newborn care, antenatal service is free. Tests like HIV, blood group, glucose, HP, prenatal drugs, and at least 2 routine ultrasound scans for that patient. Patient and pregnant, like the ones that go to the maternity, they are servants. These are their tests. The antenatal services are free. All these services are free. So cervical circulation is also free. Normal delivery, assisted vacuum or assisted delivery, they are free. Elective or emergency cesarean section are free. Dilatation and curettage for missed abortion and incomplete abortion is also free. Immunoglobulin human anti-B is free. Sterectomy free. Exploratory laparotomy indicated to control postpartum hemorrhage is free. National Program on Immunization Vaccination Schedule is free. Circumcision of male neonates is free. Hair piercing of female neonates is free. Perinatal care for the following conditions in the first 28 days. Incubator care for premature newborn, maximum of 5 days. After 5 days, patients will have to pay. So, ophthalmia neonatorum phototherapy, breast anesthesia, sepsis, they are all free. Local ambulance services for maternity emergency, for primary care facilities, free. So for dental care, preventive oral health care counseling, cleaning and polishing once a year. Cleaning and polishing once a year, free. Tooth extraction, maximum 3 per year. Dental x-ray, maximum 3 per year. Composite filing, maximum of 1 per year. For surgery, incisions and drainages, free. Suturing of minor laceration is free. For wound dressing, you have a minimum of 5 days. After 5 days, you have 5 days. You have to pay. Eniotomy, enuraphy, appendectomy is free. Lumpectomy is also free. Ganglion and simple lipoma is free. POP application for simple fracture is free. Emergency style injectomy is also free. Repair of vesico-vagina /recto-vaginal fistula is also free. I think a lot of 2005. Emergency care, establishing an intervention line, simple tracheostomy, management of convulsion, control of bleeding, cardio, pulmonary resuscitation, assisted respiration, assisted of antibac. That's free. Management of simple fractures, using sling, neck collar, they are also free. Acute asthma attack and other emergency conditions as may be visited from time to time, they are also free. So for cancer treatment, the patient, treatment of any stages, 1 or 2, stage 1 or 2, of breast, prostate, cervix, or colorectal is free. Childhood cancer, osteoblastoma, and retinoblastoma. So for a patient, after the second year, patient has limit of patient limit 1 million naira for the cancer patient. After patient access medication or treatment above 1 million naira, here we pay the extra that is on that 1 million naira. So the limit for cancer patients, cancer treatment, is 1 million naira. So, additional benefits for civil servants. Extension for retirees. For example, now if someone decides to retire this year, there is a grace of 1 year for that public servant that retired to use LASHMA. After that 1 year, the public servant can try to renew based on private scheme, or cancel the servant is no longer in the system. So, for additional benefits for patients like that, the CT scan and MRI. So for them, they can benefit CT free for them for that 1 year or MRI. Then prolonged bed rest for that retired public servant. So the patient has a maximum of 90 days of bed rest, free of charge, not paying at all. Okay. So, and please note that this is for fracture only. Bed rest of 90 days, general ward admission, for fracture cases only. So for treatment of cancer, for public servants that retired, they have a limit of 5 million naira. Unlike the other one, still in service, that's 1 million naira. So after retire, after service, 5 million naira. So that will be under surgery, chemotherapy, radiation therapy, and admission. Once costs 5 million, the extra will pay. So for cataract removal surgery, it is limited to civil servants and the registered spouse. No children. For the civil servants and the registered spouse. Free. So, so for patients that want to remove fibroids, immediate to civil servant. And it's only for severe bleeding cases. So,
if it's not here, they're not afraid. I'll not afraid.
So, provision of parent leaves. So, it is limited to principal public servants and spouse. The maximum reimbursable amount shall be 50,000 naira. So, for this specific leave, you pay. Once you pay, so the number you receive, you now send it to LASHMA. That's why now reimburse you.
You have to report that one.
You process it now. So for dialysis is renal dialysis limited to civil servant and spouse. Maximum 1 session of dialysis per week and up to maximum of 52 sessions in a year. Does not cover the cost of pre and post dialysis investigation, creation of access points and other ancillary services. Does not cover it. This service shall be carried out at any of the Lagos State Health Plan dialysis centers. Okay, open reduction internal station. Service for public servants and spouse, maybe to 1 million naira. So if you have bonds, 1 million naira. That's it. So tariff conditions including complications cover up to 1 million naira for civil servant and spouse. That's right now. If you get hypertension with end organ damage, so cover up to 1 million naira for civil servant and spouse. So current healthcare providers for additional services, we have the general hospitals, we have really Agege, Bagada, Island Maternity, Badagry, LASHMA, University Lagos, Crystal Specialist Hospitals, that provide all those essential services. So if you want to collect your claim, you find out all your receipts and you send them to email address. When you go to the office at Alauta. So you say, what are you medicine?
Why
So, there's something they call transborder care. For us, we are living in Ogun State, right? And we work in Lagos State. For us, we are living in for the people that are living in Ogun State and are working in Lagos State, it's something they call transborder care. So, transborder healthcare provision for the Lagos State public servant residents in Ogun State in collaboration with Ogun State Health Insurance Agency. So, basically, LASHMA Lagos State collaborated with Ogun State Health Insurance Agency. So, what they do is they carry out provider selection. For me now, that I'm living in Ogun State, I can decide to access care in Ogun State based on the accessible center approved by LASHMA in Ogun State. I stay in Ogun State. I work in Lagos State. Imagine, I cannot come to where my center. I can try to go to any of the centers in the state. So that's me.
Most of the time, I'm working in the hospital. My center is in the hospital.
You can go there.
I can't go to where I register.
You can. I'll tell you the procedure. I'll tell you the procedure. So basically, that's it. You have access to affected centers in the state. If you live in the state and you work in the state. So these are the name of hospitals. So this no, if they just have to I don't know. So some go, I don't know that. That's my thing. So I know. These are the affected so Mowe, Penny, Ibako, Areko, Okada, Magolo. So you need to know your rights as the so it's important to understand the relationship with your healthcare provider. So this summary shows what you need to know. You are entitled to respectfully, timely, and quality healthcare services. Are we doing that yet? Always present your enrollee ID and follow facility procedures. You need to present your enrollee ID and follow facility procedures. So patients will tell you that. So visit visit only your assigned provider unless referred. I'll tell you what to do. Get a valid referral before going to secondary or specialty care. Medicine and tests. Ask what's covered under your report at your facility. So, feedback. Report poor service complaints via our helpline. So if you want to change, you can change your hospital yourself. You have to wait for. So you just come. Yes, I can tell you. You can change it if you decide that okay, I don't want that. You can decide to change yourself. Matter of 1 month, reflect. Not reflect with the use. So that's so the customer care service complain, thank you. So I want to talk about referral code. For example, now you a particular hospital and maybe you have an emergency, so the person go to that place and just write on that hospital. Fine. Once you get there, you tell them what is LASHMA. Exactly. You will ask the referral code. You are supposed to call that facility that you are using. Or you go there after the patient, you go to this LASHMA. Go to this LASHMA in that patient and you're supposed to go to your own facility. You go there, you accept the national officer. So the national officer will generate a code for you, and you now take to that facility. So once they enter that code, you can now have access to LASHMA in that hospital for a month. For a month. After that month, if your patient is still there, you have to go and get another code. You have to go and get another code. So, then for public servants, I choose mercy. Either maternity and GH. So, if you choose mercy, either maternity and GH, you now have a surgical case. Instead of coming to GH Lagos, you now branch to maybe Orilla Baby. Now branch to Orilla Baby. So, you now call me. It's a referral code. Not getting for you. Why? Because this place is not called GH Lagos. No, I cannot do anything. GH Lagos, I attend to you. I cannot send you the code. Assuming person that you see that place, yes, I can do it. In fact, I cannot do it. But I have a say. But GH Lagos is overall for the three centers. I have a say, but I cannot review. Or you have maternity case, you now go to platform. Instead of coming to either maternity that will do it.
So, who are you going to call?
You go to LASHMA office there.
Yes.
Either maternity. You tell them your case, you check your number. It's true that once they confirm, then you now tell them, okay, your wife is doing your plan. I need a referral code. The person is getting the referral code. You now take it to that center. So once they tell you that, the I had no other. Yes.
Because this I've never agreed with that. It's not giving me anything now.
But they have their separate thing.
I went here, they did not give me anything. One single drop like this, they did not give. And I need to get I go find their FHO. Yeah,
oh, but they have their own.
I don't need their FHO. I must stop my money.
List of providers. So, what you must see.
So, what do I do? What do I do? Who is the program?
Yes. If they take that you have it, if they take that you have it, they will reject it now. They are the one that will check it. But sometimes, when they come off label and work, and this off label that works. So, I don't know. I think like they have their own medical people that check it. That patient will be inside. Because if we start to do and we they inside, what do you mean inside? If they do not give good diagnosis, being here, you cannot do anything. I don't say everything, I understand.